Welcome back to Advancing with Amy. Today we have Shannon Sauer-Zavala, PhD, is a licensed clinical psychologist and an internationally known expert on personality change. She is an author, speaker, scientific consultant, and a researcher at the University of Kentucky, where she runs clinical trials testing cutting-edge interventions that harness the power of personality change to alleviate common mental health conditions. Welcome. How are you, Shannon?
Good, thank you. Thank you so much for having me, Amy.
Oh, we're happy to have you here. All right. So I was just telling Shannon before we started talking that I've been looking at her website and you've got a bunch of personality tests on there, which I know people love. So tell me, I read that the personality tests that are available usually on the market aren't really what you're wanting.
Yeah, exactly. So part of the reason that I have a personality test on my website is because I wanted people to be able to access the same types of tests that we use in our research studies, ones that have been validated, that we know accurately capture differences between people with regard to personality. And so typically the kind of scientific community that studies personality and personality change and the folks that market commercial personality tests, they don't really overlap. And the little research there is on some of the well-known tests that you probably took in high school or your HR department gave you, they don't actually predict career success, and they haven't been very well validated.
Okay. Would that be true for like the Myers-Briggs and common things like that? Wow.
Yeah.
Well, that really puts a light on things. Tell me a little bit about what you do.
Sure. Yeah. So my main gig, I guess, is as a clinical trial researcher at the University of Kentucky. And in that role, I develop new treatments for anxiety, depression, some personality disorders. And then I try to get the government to give me money, like grant money, so that I can test them. And yeah, so that's really my main gig is to try to improve upon existing cognitive behavioral treatments that we have for these common mental health conditions. And really the goal is to make them more efficient, more potent, better able to be personalized so that care can be more accessible to folks in the community. It can be really hard to find a good therapist. And so we want to be able to make treatments easier to access.
Okay, well, that makes sense. And I saw in there that you actually have a new treatment for borderline personality disorder, which
Yeah.
I've always heard is like the hardest to treat.
Yeah, so one of the really that's a really interesting point because that's a really common thought about BPD, and actually BPD responds really well to treatment. And so our treatment is 18 sessions long, so it's about a 5 month treatment. It's outpatient, and we see the same effects, so the same decreases in borderline symptoms as have been sort of previously recorded in trials that are a year long and like twice a week. Kind of gold standard
Right.
interventions for BPD.
Wow, that's exciting.
Yeah.
Yeah, I have a lot of members that would benefit from that, and I know we've struggled finding effective therapy, so I'm going to have to bring that up at work.
Yeah. And, since part of my mission is to make treatment more accessible, we actually give the workbook that we've been testing away for free on my website. So you
Oh,
can just
wow.
you just download it. And it's nothing fancy at this point, right? So it will be published eventually, but because I'm pretty particular about quality control, I want to make sure that it is well tested and is the best that it can be before it's available sort of like on the market for people to pay for it. I want it to be published through Oxford University Press's Treatments That Work series. And so in order to be in that series, you have to demonstrate through research that, it does indeed work. Yeah, we have good evidence that it works pretty well enough that we would want people to download it and take it to their therapist and be like, "Hey, can you work through this with me?"
Right. That's wonderful. So I also saw that you were a TEDx speaker. What did you give your TEDx talk on?
Yeah, so I gave my TEDx on intentional personality change. And I think the TEDx is like kind of a I don't know, it's sort of the way that my treatment research and my interest in personality come together. So, like I said, my main job is developing new treatments and trying to make treatment more accessible, more efficient. And so one of the ways that we do that in the lab and in our treatment studies is to target personality instead of symptoms. If you and your listeners are familiar with the DSM, that's like our big book of mental health conditions, right? And so there's lots of different disorders in the book. And historically, the way that you treat it is that there's a manual or a protocol, the treatment for each disorder. And that's a huge pain in the neck for therapists because, you have to learn 40 different treatments to be able to treat whoever walks through your door. And because of that, often therapists who are being sort of pushed by their employers to see more and more patients don't have time. They don't have the training, they don't have the prep time to be up to speed on all of the interventions. And so research tells us that most of the common mental health disorders that people have, that the risk factors for those are just these five broad dimensions of personality. So most common disorders kind of are a product of neuroticism, which is just like a vulnerability to experience negative emotions. And so we've shown over the past 10 years that if you treat neuroticism, just you treat someone's tendency to experience negative emotions, you can see simultaneous improvement across anxiety, depression, eating disorders, BPD. And so there's four other dimensions of personality. One is like conscientiousness, low conscientiousness or disinhibition is what we see as like a risk factor for substance use or ADHD. There's like antagonism versus agreeableness. And there we see deficits in folks with PTSD or like complex PTSD, right? Like because they're sort of like pinging on mistrust part of like interpersonal relationships. So again, it's like way more efficient to target these five domains of personality than have 45 different treatments. So that's like how I got interested in personality and how treatment comes together. And so back to your question. The TED Talk on intentional personality change. And so in these clinical trials where we're treating people with BPD, we see big improvements in personality. But the common sort of thought about personality is that it's unchangeable. And so at the same time I was working on that, I don't know, I in my private practice, I have like a bunch of like Gen Z college students that take their sort of like Myers-Briggs or the Enneagram results as like the honest truth about who they are. Like, I can't date that person because they're not like their personality is not compatible with me based on this test that we took. That, by the way, isn't validated by research. And so the TED Talk really was, I guess, like the thesis statement of it was that we know that personality can be changed through intentional action. So, like, why don't you let your dreams dictate the traits you develop rather than put yourself into a box based on what a personality test tells you and do that?
That is so hopeful. I love that. Yeah. So, because I've always heard that your personality is ingrained in you and you're going to be that way for the rest of your life. So to know that you can change that and therefore change your future, that's incredible.
Yeah, yeah, absolutely. And so, like, I think people can be really precious about personality. They think it's like their tastes and their sense of humor and their value system. And in an academic sense, that's not actually how we define personality. We define it as your characteristic way of thinking, feeling, and behaving. And, it may sound like, oh my gosh, it's impossible to change your personality, but we change our perspective. We change how we feel about things. So we change our behaviors or our habits all the time. If you do that in a consistent way, then you're going to fill out the bubbles on the personality questionnaire differently, if you maintain those changes over time. So it
That
really
really
is
makes
beautiful.
sense. Yeah. Well, do you have any stories or any like successful cases that you could talk about?
Yeah, yeah. I mean, one of the things that I talked about in my TED Talk was my own journey and like what that looks like. So I am like a pretty successful academic. I have like here, I'll show you. I have a monogrammed planner that I custom designed. So I'm like with these sort of like off the charts and conscientiousness, but it had not always been that way. And so, when I was like, my students are always shocked to hear this, but like when I was in high school, I skipped math so much that I failed the course for the year and had to take it over.
Oh,
um,
no.
absences all the time in early college, cleaned by just like shoving stuff under the bed, or just would be like very easily described as like pretty lazy and pretty messy. And, I enrolled by chance my freshman year of college in an introduction to psychology class. And even though the class was at 8 a.m. in the morning, it was interesting to me. So I managed to get myself up and to go to every class. And after the first month, we had our first exam, and I did really well on it. And I remember this so clearly. The TA was like, Shannon, you should seriously consider majoring in psychology. And that was so reinforcing to me. It was like, oh, I studied a little bit harder for this one thing, and all of a sudden, like, getting praised. And it really changed how I saw myself. Like, I mean, it's kind of cheesy to look back on it because gosh, I'm good at psychology. Like, that's a thing that I'm good at. Enrolled in more classes, did major in psychology, and continued to do really well. And so reinforcement is a really big, I think, driver or principle when we're talking about personality change, right? So like and reinforcement just means when a rewarding experience that follows a behavior that increases the likelihood that you'll do it again, right? So if it feels good to get a good grade, you're probably going to study again because that worked last time. So my junior year, I was like super feeling myself as budding psychologist, decided I'm going to go to grad school for psychology. And, just to highlight how different I was even like a couple years later, we actually had a psychologist come to my high school and talk about her journey towards that career. And I remember thinking at the time, there's no way I'm gonna do that, that's way too much school. So 3 years later, here I am, I wanna go to grad school, and I talked to one of my professors about it, and she was like, "Well, you're probably not gonna get in because your overall GPA is too low, and it's really competitive." And this is another place where reinforcement, is sort of brought to bear, right? Because the whole purpose of negative emotions, like guilt, like I feel guilty because I like screw around in college and now I don't have the GPA I need to do what I want. The whole purpose of guilt is to motivate you to change your behavior so you don't make the same mistakes over and over again. And so you don't have to feel that way again. And so I managed to buckle down. I managed to get my grades above like the magic like 3.5 threshold by my last semester of college. And I didn't get in the first time I applied, but I eventually got into grad school. And, in grad school, I think that's where the personality change like really snowballed or sped up because the demands increased exponentially, right? And so I really when I succeeded at things, it was even more reinforcing. When I planned, yeah, I planned, and when I kept myself organized, I did better, and so that kinda kept me doing that. And then the other principle for personality change is identity, how we see ourselves. And so, if you tell yourself, "I'm the type of person that needs the adrenaline of the last minute to study or pack," or whatever it is, right? Like, that's not truth, right? You don't need adrenaline to open a book.
Right.
That's a narrative that we tell ourselves, right? So I'm telling myself, good at psychology. I'm telling myself, my students are counting on me, right? And so those are the things that identity really prompts me to kind of continue to act in line with a particular trait. And so I think the thing to highlight here is that I went from like this isn't like oh, here's how a conscientious person plans. It's like, here's how a person that really was like not performing very well at all made changes over the course of several years that brought me to where I am now. And certainly if I had filled out a personality questionnaire my senior year of high school and filled one out now, it would be very different.
Wow. Yeah, I've changed a lot. Well, I'm 53 now, and I've changed a lot over
Mhm.
the last 50 years. So, yeah, that does make sense. I gotta say that I think it works the other way as well. I've known people that I've done this myself when you get in a rut and you start to think I'm not good at that, and then that snowballs the other way. So,
Exactly. Hmm.
yeah.
Right. And that's where I just got like feel like I need to get on my soapbox about these personality tests because I would hate for somebody to take a test, especially somebody young, and have them be like, well, that's who I am. So I couldn't possibly, have a leadership position in my job because I'm introverted. Right. When that's not like
Right.
just be true. But so really want that's part of my motivation for coming on podcasts is to be like,
That is
I'm
great.
going those tests.
Is there anything you want to just leave our listeners with today as some sign of hope?
Yeah, sure. I mean, I'll just kind of reiterate my party line, which is that don't let these personality tests put you in a box. Don't stay in a lane because a personality test told you this is how you are right now. Personality changes naturally across the lifespan, and that you can intentionally speed up or push, your personality in a particular direction based on your personal goals and values.
That's great. And where can people find you? Would you give us your website address? And
Absolutely. Yeah. So probably the most direct place to find me is my website. And that's www.personality-compass.com. And I'm on all the social media. So at Sauer-Zavala on Twitter and at self.made.personality on Instagram. I'm on LinkedIn. I don't know how you're supposed to cite that though.
no, that's okay because I'm going to put all that in the show notes for everybody.
Perfect.
So thank you very much for coming on today. I really enjoyed it.
Sure. Thank you.
Okay. And that's a wrap for today's episode of Advancing with Amy, mental health warrior and neurospicy mama. I hope you found our conversation with Dr. Shannon Sauer-Zavala as enlightening and inspiring as I did. We covered a lot of ground today, from the myths around personality tests to the innovative treatments being developed for mental health conditions. A big thank you to Shannon for sharing her valuable insights and research. For those of you eager to dive deeper, remember that Shannon offers a free downloadable workbook on her website specifically designed for treating borderline personality disorder. You can find it on her website, and I'll include the links in the show notes. It's an excellent resource to bring to your therapist and start working through together. Before we sign off, I have a small favor to ask. If you enjoyed today's episode, please take a moment to rate, review, and share. Your feedback helps us bring more incredible guests like Shannon and continue providing valuable content to our listeners. Don't forget to subscribe so you won't miss any of our upcoming episodes. Thank you for tuning in. This is Amy, reminding you to keep advancing and stay strong. Until next time.